is Tola and I'm a pharmacist. I promote health and wellness. In this video, I'm going to be talking about cystitis. Okay, so let's go straight into it. Cystitis is an inflammation of the bladder. So it's a UTI, it's a urinary tract infection, and it occurs both in women and men. For men, it may not be as common as in women because men have a longer urethra. So the urethra is a tube that helps carry urine, from the bladder out of the body. The urethra offers more protection because of its length in men. Okay, now it offers more protection because of its length in men. It acts as a barrier to bacteria, especially in men below the age of 50. So it helps to, prevent cystitis in men. So obviously, if a man experiences cystitis, he needs to see a doctor. So cystitis is more common in women, and in fact, up to 50% of women will have cystitis once in their lifetime, according to research. So now, what are the causes of cystitis? The main cause is bacteria. So the bacteria called the E. coli, which could be in the bowels or in our GIT. Bacteria from the bowel area can get to the urethra through the anal area and multiply and therefore get to the bladder. The bacteria from the bowel, it goes through the anal area into the bladder. Some medication can also cause cystitis, and sometimes it could be associated with menopause. Now, let me just go through the symptoms of cystitis. Sometimes there's pain when urinating, especially towards the end of passing urine. There could also be stinging and burning sensation. There's increased frequency and urge to pass urine. There's increased urination at night as well. Also, sometimes, one may be passing small amounts of urine and feeling like peeing soon again afterwards. And there could also be pain in the lower abdomen and dark and cloudy urine. These symptoms usually can resolve on their own within a few days. But you need to see your doctor if you are experiencing the following. First of all, if you're a man and you're experiencing these symptoms, you need to see a doctor. If there is blood in the urine, in which case, it could be a sign of something more serious, and you need to see a doctor. If the person experiencing cystitis is under 16 or over 50, they need to see a doctor. If you're pregnant, you need to see a doctor. If it keeps reoccurring, I will advise you see a doctor. If there's vaginal discharge present, definitely see a doctor. If your temperature goes beyond 38 degrees centigrade, please see a doctor. Now, if you're at risk of other complications like maybe diabetes, or if you're immunocompromised, you need to see a doctor. If your symptoms go over 3 days and there's no improvement, I will advise you see a doctor. It's also, good to note that the symptoms can appear, or they could be similar to other conditions, so it is essential that we get it checked properly. I just want to share some tips to help when you experience cystitis. Women are advised to wipe from front to back. You need to drink lots of water daily, about 3 to 4 liters of water if you're experiencing cystitis. This helps to flush bacteria out. There are over-the-counter treatments available from your local pharmacy, but make sure you speak to the pharmacist, especially if you are taking, other medications, so they will know which one is appropriate for you. Cranberry juice has been found to reduce the recurrence of cystitis, but it could interact with some medication, for example, warfarin. So you need to check with, if you are on any other medication. You need to check with your pharmacist or your doctor before you take cranberry juice. I would love to drop a disclaimer here actually. So this video is just for education purpose. It's not intended to treat or diagnose any ailment. please speak to your pharmacist who could advise you or point you in the right direction. Thank you for watching this video. Please like and share, and please subscribe to this channel. Bye.